Much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. Thanks to the collective determination and resolve of the nation, we are winning this battle. We've flattened the curve, we've protected the NHS, and together we've come through the peak. Yesterday, I was able to announce that the level of daily deaths is lower than at any time since lockdown began on the 23rd of March. And today's ONS data show that the level of excess mortality is also lower than at any time since the start of the lockdown, falling on a downward trend. ONS reports 12,288 all-cause deaths in England and Wales in the week ending the 22nd of May, and this is down from 14,573 in the previous week. This latest figure is still above the average for this time of year, and we must not relent in our work to drive it down. But it is now broadly in line with what we might typically see during the winter. We never forget that each of these deaths represents a family that will never be the same again. And Mr. Speaker, this House mourns each one. Mr. Speaker, we are moving, though, in the right direction, but this crisis is very far from being over. And we're now at a particularly sensitive moment in the course of the pandemic. We must proceed carefully and cautiously as we work to restore freedom in this country, taking small steps forward and monitoring the result, being prepared to pause in our progress if that is what public safety requires. So today I'd like to update the House on two important aspects of the action we're taking. First, NHS Test and Trace is now operational. And this means that we've updated our public health advice. Since the start of the crisis, we've said to people that you must wash your hands and self-isolate if you have symptoms and follow the social distancing rules. All of these remain incredibly important. But there's a new duty, and it is a duty, that we now ask and expect of people. If you have symptoms, that's a fever, a new continuous cough, a change in your sense of taste or smell, if you have one of these symptoms, you must get a test. We have more than enough capacity to provide a test for anyone who needs one, and we have more than enough capacity to trace all your contacts. So to repeat, if you've got symptoms, get a test. That is how we locate, isolate, and control the virus. And by the way, I make no apology for this overcapacity. The fact that we have thousands of NHS contact tracers on standby reflects that transmission of the virus is currently low. If we were in a position where we needed to use all that capacity, it would mean that the virus was running at a higher rate, something that no one wants to see. Second, Mr. Speaker, I want to update the House on the work we're doing to understand the unequal and disproportionate way that this disease targets people, including those who are from black or minority ethnic backgrounds. This is very timely work. People are understandably angry about injustices. And as Health Secretary, I feel a deep responsibility because this pandemic has exposed huge disparities in the health of our nation. It is very clear that some people are significantly more vulnerable to COVID-19. And this is something I'm determined to understand in full and take action to address. Today, I can announce that Public Health England have completed work into disparities in the risks and outcomes of COVID-19, and we have published their findings. PHE have found the following. First, as we're all aware, age is the biggest risk factor. Among those diagnosed with COVID-19, people who are 80 or older are 70 times more likely to die than those under 40. Being male is also a significant risk factor. Working age men are twice as likely to die as working age women. Occupation is a risk factor, with professions that involve dealing with the public in an enclosed space, such as taxi driving, at higher risk. Importantly, the data show that people working in hospitals are not more likely to catch or die from COVID-19. Diagnosis rates are higher in deprived or densely populated urban areas, and we know that our great cities have been hardest hit by this virus. And this work underlines that being black or from a minority ethnic background is a major risk factor. This racial disparity holds even after accounting for the effect of age, deprivation, region, and sex. The PHE ethnicity analysis did not adjust for factors such as comorbidities and obesity, so there is much more work to do to understand the key drivers of these disparities, the relationships between the different risk factors, and what we can do to close the gap. I want to thank Public Health England for this work. I'm determined that we continue to develop our understanding and shape our response. And I'm pleased to announce that my honourable friend, the Equalities Minister, will be leading on this work and taking it forward, working with PHE and others to further understand the impacts. We need everyone to play their part by staying alert, following the social distancing rules, isolating, and getting a test if you have symptoms. We must not relax our guard, but continue to fight this virus together. That is how we'll get through this and keep driving the infection down. I commend this statement to the House.
We now come to the Shadow Secretary of State with up to 5 minutes. Jonathan Ashworth.
I'm grateful, Mr. Speaker. There have now been 56,308 excess deaths since the beginning of March, 12,500 of which are not related to COVID. But we do have one of the worst excess death rates in the world. Why does the Secretary of State think that is? And what does he believe is the cause of the non-COVID excess death rates as well? With respect to the PHE findings, which I'm pleased that are being published today, we've always known that there is a social gradient in health. The poorest and most deprived have inequality in access to healthcare and an inequality in health outcomes. What the Secretary of State has confirmed today is that COVID thrives on inequalities. Yes, indeed, Black Lives Matter, Mr. Speaker, but it is surely a call to action that Black, Asian and minority ethnic people are more likely to die from COVID and more likely to be admitted to intensive care from COVID. He's seen the findings. I note that the Equalities Minister is taking work forward, but what action will be taken to minimise risk for Black, Asian and minority ethnic people? On the point about risk, there are other vulnerable groups highly at risk. He will have seen today, I'm sure, the CQC report that shows a 134% increase in deaths of people with learning disabilities. Surely it is now time to expand testing to those under 65 in receipt of adult social care. On the easing of restrictions, he said this is a sensitive moment. Well, quite, Mr. Speaker. Our constituents have concerns and are looking for reassurance, particularly those in the shielding group. They really shouldn't have had to wake up on Sunday morning to find out that they could now leave the house once a day. They need clarity in details. And why weren't GPs informed in advance? We're still at around 50,000 infections a week. So can I ask him, or press him a bit further on the easing of restrictions? The biosecurity level remains at 4, but his own command paper from May 11th said that changes to lockdown must be warranted by the current alert level. And at the Sunday news conference, the Community Secretary said all the proposed easings of restrictions had been modelled and showed the R value remained below 1. That is, of course, reassuring. But will he now publish that modelling so it can be peer-reviewed? The easing of restrictions was based on tests, so I can ask him a couple of questions. First, on NHS capacity. We know the NHS has not been overwhelmed, but that has been on the back of cancelled planned surgery, delays to vital treatment, postponing of cancer screening, arguably the biggest rationing exercise in the history of the NHS. Will he now publish the total number of planned operations that have been cancelled and detail them by procedure? And as the lockdown is eased, is it his intention to step down some of that surge capacity so this backlog in clinical need can start to be tackled? On managing the virus, his tests, one of his tests is on whether we can manage the virus, but this depends on testing and tracing, as he has said. There's now capacity for over 200,000 tests, but there's still a lack of clarity about how that figure is arrived at. The UK Statistics Authority have written to him today saying that his figures are still, quote, far from complete and comprehensive, that the testing statistics still fall well short of standards in the code, and that it is not surprising that testing data is mistrusted. I mean, this is quite damning, I have to say, to the Secretary of State. So will he start publishing again the actual numbers of people tested? Will he stop counting tests mailed to homes as completed? Can he detail what proportion of the 200,000 tests are diagnostic PCR tests What proportion are antibody? What proportion are surveillance? Can he tell us how many care home staff and residents have been tested? And when will he start weekly testing of all NHS staff? That is crucial for getting on top of infections in hospitals. And can he tell us what percentage of the Deloitte's run testing facilities have been sent to GPs? Now, on test and trace, this is absolutely vital to safe easing out of the lockdown. Last week, the Prime Minister told the House, or before the recess, the Prime Minister told the House that it would be world-beating and operational by yesterday. But it's not actually fully operational at a local level, is it? Can he confirm that local directors of public health have been told to prepare strategies for tracing with a deadline of the end of June? That they won't actually start receiving local individual data until next week, and many still haven't been told their allocations of the extra 300 million, nor what they can spend it on yet. When will they get those allocations? Despite this yesterday, he said test and trace is up and running. I'm not sure how we can say it is up and running when local directors of public health are still asking for this information. And will he publish the data on what percentage of infections have been contacted and how many contacts have been followed up? Will that data be published on a daily basis? Mr. Speaker, this is a crucial week given the easing of restrictions, and our constituents want reassurance and clarity. But trust has been undermined by the Dominic Cummings scandal, I'm afraid. Our constituents want to do the right thing for their loved ones and their neighbours. Can he give them those reassurances today?
Thank you very much, Mr. Speaker. And I entirely agree with him that it is critical that people play their part in making sure that we continue the work of controlling this virus and driving down the number of new transmissions. I'm glad that he recognises the work that's been done, which is not really just the work of government, it's the work of all of us to get this virus under control. To answer his question specifically, he asks about the inequalities in health outcomes. He's quite right to address this subject. It's a subject that was important before we went into the coronavirus crisis, and it is even more important now. Black lives matter, and as do those of the poorest areas of our country, which have worse health outcomes. And we need to make sure that all of these considerations are taken into account and action is taken to level up the health outcomes of people across this country, because there is no more important levelling up than the levelling up of your life expectancy and the quality of health with which you live that life. He asked specifically about those with learning disabilities and autism. That testing in care homes for those of working age has continued all the way through this crisis, and we're rolling it out further. He mentions the changes to those who are in the shielding category. I was very pleased we were able to make these changes. We announced them at the weekend, and they've been very well received, especially by those who are shielding, because they're now able safely to go outside, which it's hard to underestimate, Mr. Speaker, the impact of saying to people that for 10 weeks, the recommendation, medical advice was that they shouldn't go outside. And I'm very glad we've been able to lift just slightly the restrictions on those in the shielding category. He asks also about the restart of the NHS. It is vital that we get the rest of the NHS going again. That work is underway. The expansion of cancer facilities is underway. The demand for A&E and urgent care is not as high as it was, but I look forward to the full restoration, Mr. Speaker, of our A&E facilities across the country and also in central Lancashire. He asks rightly about the NHS test and trace capability. That is up and running and working well. He asked how I can say it's working well. It's working well because thousands of people have been contacted and are being traced. Their contacts are being traced, and so the system is working. We absolutely will publish data on that. But as the letter from the chief statistician from UKSA shows this morning, it is very important that we get that data publication right. And so we will work with the UK Statistics Authority to make sure that they are happy with how we're publishing that data, to make sure that we get the data published in a reasonable and sensible way, in a way that also supports the operation of NHS Test and Trace, which we agree is an absolutely critical part of the next stage. So I commit to publishing that data and to working with the UKSA on how that data is put together. The final point in response that I'd say, Mr. Speaker, is that the goal here is to have a more targeted approach to the lockdown so that we can carefully and cautiously lift the broader lockdown. That is what we're working to achieve, and I am very grateful for the support right across the House of our efforts to accomplish that.
John Lamont.
Thank you very much, Mr. Speaker. Can I start by thanking the NHS and care workers in my own constituency in the Scottish Borders for working so hard to keep us healthy. The Health Secretary will be aware of the very low levels of testing taking place in Scotland, which is clearly a concern as we move into the test and isolate phase. So I wonder, given the role of the UK Government in providing test facilities in Scotland, what further assistance can the UK Government provide to the Scottish Government to help push up the testing numbers?
Well, we have supported and helped the Scottish Government throughout this, because whilst they've missed their targets in terms of test rollout of those delivered within Scotland, the UK programme of the drive-through centres and the home test kits has also been operational in Scotland. So I work very closely with my Scottish counterparts to try to make sure that testing is as available in Scotland as it is in England, and that work is ongoing.
Sure. Ian Blackford, leader.
Thank you, Mr. Speaker. I'm here today standing in for my honourable friend, the member for Central Ayrshire, who is excluded from taking part, given the removal of the hybrid parliament for now. Mr. Speaker, there are growing concerns that this Tory government is taking a cavalier approach on coronavirus by rushing to ease lockdown measures despite warnings from public health experts. There are serious questions to answer over the political decisions the Prime Minister and the Health Secretary have taken, which could increase the rate of infection and put lives at risk, or even cause a second wave of COVID-19. The government claims to follow the science. So why have they ignored the experts who have advised against opening schools or easing lockdown further, without pausing to evaluate each step? On what basis were the decisions made to allow groups of people from 6 different houses to meet in England, to tell 2.2 million in the shielded group that they can go outside, to send people back to work in England on the 11th of May without a functioning test, trace and isolate system in place? The results from the Deloitte regional test centres are still not being reported to local public health teams. How does the Secretary of State plan to fix this, and by when? What financial support will be put in place for those so-called on to isolate as asymptomatic contacts, especially as this could happen on more than one occasion? With test and trace depending on people being willing to isolate, if told by a contract tracer, does the Secretary of State not regret that he and his Cabinet colleagues have completely shredded their own lockdown rules to protect a man who thought he was above the rules? In refusing to sack Dominic Cummings for travelling 260 miles with his wife, who was symptomatic, the Prime Minister has destroyed his own stay home and save lives message. We know that the Dominic Cummings scandal has undermined efforts to tackle the virus by eroding trust in the UK government and its public health guidelines. And we have seen that people are breaking the rules as a result. Does the Secretary of State not recognise that the scandal has already undermined lockdown and could lead to more infections and even more deaths in the future? This is about leadership and it's about responsibility. Dominic Cummings should go, and he should go now.
Stay.
Well, Mr. Speaker, I look forward to my SNP opposite number returning to be able to have a constructive discussion about how we might together tackle the virus, how we might together protect those who are shielding, who now thankfully it is safe for them to go outside based on the clinical advice, how we can ensure that the test and trace system is rolled out across the whole of the UK and how the systems can interact together and work together to protect people, especially in border areas where people may need to make journeys over the border. How we can work together as a whole country to keep this virus going down, the number of new infections going down. How we can work together to protect people and to protect our NHS. Those are the conversations that I have with the Scottish Government, indeed with my SNP opposite number here in Westminster, and those are the things that really matter.
I'm expecting to run this till 2 o'clock. Hurry up, Baldwin.